Well, good afternoon, Dr. Theocharides. Dr. Theocharides.
Hi there.
Hi. Sexual sensation improvement. It exists for men, lots of it out there. The truth of the matter is apparently there also do exist things for women. And wholly and behold, a dermatologist, a cosmetic surgeon like you apparently has ways to do that. Who would have thought? Can you tell us about it a little bit?
Well, especially with my initial training in OBGYN, obviously the female sexual issues are not foreign to me. And there's no question, I mean, women have options. What I mean by that is a woman who's had vaginal deliveries, who perhaps is getting older, may have lost some of the support of the vagina, so that during intercourse there may be less sensation. For some women, that's a significant affects their ability to enjoy sexual activity.
Right.
For others, it could be the labia, the outside lips, that are either too large and sometimes are catching, whether it be it with clothing or even during the act of sex. So there are things we can do to restore or to make the anatomy more pleasing or more functional depending on the patient's wishes. Women have choices, and that's the exciting thing these days.
I suppose so. So basically, if a person, a lady undergoes such a procedure, number one, so she knows it because she's losing pleasure, basically, and she feels, for lack of better word, loose. And so she comes to a doctor like you, and you decide that, okay, this and this operation could be done. And just in a big picture term, what's involved here? Does the lady have to be hospitalized a day, 2, 3? What are we talking about?
This is generally an outpatient procedure, and depending on what's the need, we actually sometimes we cut away some tissue to actually tighten the opening. In other situations, we use lasers to actually do the cutting. A laser sometimes just simply heating of the deeper area that causes some collagen to shrink and has a tightening effect. There's a lot of there are different ways we can go about achieving, depending on what the objective is and where the weakness or the looseness is.
Okay, outpatient procedure, meaning lady comes in, gets your diagnosis, maybe schedules an appointment right there and then. Anyway, whenever the procedure is happening, an hour or two later she's out and she's functioning again, can go to work, can go about business.
Well, depending, some people will have some sedation. We generally do some of these under local or some what we call conscious sedation. If they're getting any kind of medication like that, there's no driving for the first 24 hours, just like someone who had maybe an outpatient procedure at a hospital. But other than that, there could be up and about the next day. Obviously, when it comes to sexual activity, there's going to be a restriction, usually a number of weeks. How many weeks depends on the extent or what exactly was done.
Well, all right. Good. So basically, just like with a heavy, let's say, impacted molar operation, you want to have somebody driving you home afterwards and maybe rest that day, and the next day you go about it. And in this particular case,
Right.
However, maybe no sex for a couple of weeks or whatever it might be.
At least 2, sometimes 4, sometimes longer, depending on the extent of the procedure. Obviously, the last thing we want to do is do a sexual activity prematurely and then go back to square one. That's never a desired result.
Of course not. Once such an operation is performed, I always ask kind of like, how long does that stuff last? How long does this, the effect of the operation can be felt by the lady?
We would usually expect it to last several years.
Wonderful. Absolutely wonderful. Very informative.
It's important to maintain, to maintain health, exercise, support all the structures around the vagina. And the more you are, you take care of your body with proper nutrition, exercise, the better the results and the longer they last.
Right, and I'm sure you will give your patient some take-home material of like, those are the things you could and should do in terms of what you call maintenance, right?
Oh yes, very explicitly.
Yeah, because last time I talked to somebody about eating better food, he'd switched from donuts to pretzels. And I don't think that would work. So, you know, I'm sure you give very correct instruction of what should be done, right?
Yes.
Good. Thanks a lot, Dr. D.